Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources while providing quality care. In last week's blog I shared Intensive Care at Home, now part of Health XL. You can check out last week's blog by clicking on the link below this video. In this week's blog I want to share where do long-term ventilated adults and children in Australia go. Now, as you know, the number of long-term ventilated adults and children with tracheostomies in Australia and all over the world is increasing. We are now getting inquiries from people all over the world for our services. Providing intensive care at home for long-term ventilated adults and children with tracheostomies, rather than keeping them in intensive care for many weeks or many months, makes a lot of sense for patients and their families. It helps improve the quality of life for patients and their families, and on an economic level it brings the costs down by around 50%, and it helps free up in-demand and precious intensive care beds. At the moment, the only first world countries who have a proven and reliable alternative for long-term ventilated adults and children with tracheostomies to leave intensive care and go home are Australia and Germany. And in Australia, Intensive Care at Home thus far is the only service provider who has third-party accreditation to provide intensive home care. But the question that we also get is what's happening with long-term ventilated adults and children with tracheostomies who are already in the community. And we also get people calling us who are literally left with little or no support, who have a loved one at home on a ventilator with a tracheostomy. The current situation for most long-term ventilated adults and children with tracheostomies in Australia at home is a sad state of affairs, really. Most patients and their families are suffering in silence if they are at home. It's crystal clear for us as a quality and accredited service provider who has the know-how and also third-party accreditation that many long-term ventilated adults and children with tracheostomies and their families are not getting the support that they need. This is evident by some hospitals claiming that they don't have the resources to provide more than 30 hours a week of attendant care support and 8 hours a week registered nursing support. As I said, it's a very sad state of affairs. Some people that come to us say that their families can't work and stop producing an income because they are in a position where looking after their loved one on a ventilator has taken over their family's life. They're telling us that their whole lives have changed in terms of income, careers, family relations, stress levels, etc. And unfortunately it hasn't changed to the better. Most services who claim that they can quote-unquote provide services to long-term ventilated adults and children with tracheostomies are not accredited to do so, and therefore are working way outside of their scopes of practice. Providing services to long-term ventilated adults and children with tracheostomies without accreditation and without highly skilled and qualified registered nurses is dangerous, and I would even go as far to say that it's negligent. The reason I'm saying this is that we have evidence that most long-term ventilated adults and children with tracheostomies at home who are not looked after by a specialized and accredited service like Intensive Care at Home have regular ICU and hospital readmissions. And of course they do. How can attendant carers prevent a hospital readmission for somebody on a ventilator with tracheostomy? How can a family who is already stressed out because they get no or little support and respite keep their loved one on a ventilator with tracheostomy out of ICU or out of hospital with little or no support or with an attendant care agency? It's nearly impossible. Attendant care agencies also can't be proactively marketing their services to intensive care units to help them manage their resources better by discharging long-term ventilated adults and children with tracheostomies home from intensive care. Again, intensive care at home as a fully accredited and specialized intensive home care nursing service can do that and can help ICUs facilitate discharge home for some of their long-term ventilated adults and children with tracheostomies. We also work with KPIs, key performance indicators, and what stands out for us is that we mostly deliver on our number one KPI, which is 0 readmissions back to intensive care. Again, working with attendant carers who work with long-term ventilated adults and children with tracheostomies have their clients go back to ICU all the time. Even some public agency who claim to be the experts when it comes to long-term ventilated adults and children with tracheostomies have their clients go back to hospital and to ICU all the time. It would therefore be much smarter to look at an option like intensive care at home, where the result to have quality of life, and in some instances quality of end of life, is guaranteed. We are also strong advocates for our clients and their families because our clients are our bread and butter. What are your thoughts? Do you think that having little or no support at home for long-term ventilated adults and children with tracheostomies is the way to go? Would you want your family member at home on a ventilator with no support, or would you much rather have a specialized and accredited service like intensive care at home? Leave your comments on the blog. For more information how we can help you or long-term ventilated adults and children with tracheostomies, contact me on 041 094 2230 or simply send me an email to patrick@intensivecareathome.com.au. That's Patrick just with a K at the end. So, thank you for tuning into this week's blog, and I'll see you again next week in another update. Also, we are a TAC and DVA Department of Veteran Affairs approved community service provider, and we're also currently hiring enthusiastic and experienced intensive care nurses with critical care certificate for clients in Melbourne. We would also like to hear from you if you have a minimum of 2 years pediatric ICU experience, as we have opportunities there as well. Thank you very much.